Hey everyone, and welcome to The Explainer. Today, we're diving into something that sends over 250,000 people in the US straight to the emergency room every single year: appendicitis. We're going to break down what it is, why it happens, and what that sudden sharp pain is really trying to tell you. Look, we all get stomach aches, right? But most of the time, it's just noise. This explainer is all about the one ache that isn't noise. It's a signal, a very specific alarm bell going off inside your body. So, when that pain shows up, what is it actually saying? Let's find out. So, to understand the warning, we've got to meet the messenger. And that messenger is the appendix. So, what is this thing? Well, for most of your life, it's just a small, quiet part of your anatomy, a mysterious little pouch that has a huge potential to cause a whole lot of trouble. It's all in the name, really. Appendicitis. You see that itis at the end? That's just a medical way of saying inflammation. So appendicitis is literally just when this small, finger-like pouch gets angry, swollen, and inflamed. It's not a general stomach ache. It's one specific organ sending out a major distress signal. And its location? Oh, its location is everything. You'll find it tucked away in the lower right part of your abdomen. Knowing this spot is so critical because, as you're about to see, this area becomes ground zero for the entire problem. So how does this quiet little pouch suddenly turn into a ticking time bomb? Well, it's a surprisingly fast chain reaction, and it almost always kicks off with a simple blockage. Think of it as a three-step process. First, the opening to the appendix gets blocked by something, maybe some hardened stool. Then, because they're trapped, the bacteria that normally live there start to multiply like crazy. All that activity and pressure leads to swelling and infection, and that's what we call appendicitis. Okay, once that chain reaction starts, your body does not waste any time sounding the alarms. The symptoms of appendicitis are like a classic built-in warning system, and learning how to recognize them is absolutely crucial. Now this right here, this is the single biggest clue. The pain from appendicitis takes a very unique journey. It almost never starts where the appendix is. Instead, it usually begins as this dull, annoying ache right around your belly button. Then, over the next few hours, that pain migrates. It moves down and to the right, getting sharper and locking in on that one specific spot. That movement of the pain is the hallmark sign you just can't ignore. But it's not just about the pain. Your body is throwing other signals out there too. A complete loss of appetite is often one of the very first things to happen, sometimes even before the pain gets really bad. And that's usually followed by nausea, maybe some vomiting, and a low-grade fever. It's a full-body response to that one localized infection. Okay, so you've recognized the signs, you've gone to the doctor. How do they solve the mystery? How do they confirm it's appendicitis and not one of the 100 other things that can cause stomach pain? Well, they follow a very clear diagnostic path. It all starts with the physical exam. A doctor will gently press on your abdomen. They're checking for tenderness, sure, but what they're really looking for is something called rebound tenderness. That's the sharp jolt of pain you feel when they suddenly let go. It's a huge clue that the lining of your abdomen is getting irritated. Next, they look for evidence of the battle that's happening inside you. Your body's soldiers against infection are your white blood cells. A simple blood test will show if their numbers are way up, which is strong confirmation that your body is fighting something serious. And finally, to get the smoking gun, they need to actually see the appendix. That's where imaging comes in. A CT scan or an ultrasound lets them get a direct look. Is it swollen, inflamed? This visual proof is what seals the deal and makes the diagnosis official. So once that diagnosis is confirmed, the path forward is pretty clear. It's time to remove the source of the problem. The definitive treatment is a procedure called an appendectomy, which is just a fancy way of saying they surgically remove the appendix. Sometimes they might use antibiotics first, but surgery is the gold standard because it's the only way to guarantee that appendix won't burst. And there are two main ways to do it. The most common method today is laparoscopic surgery. Think small incisions, a tiny camera. It's minimally invasive, and the recovery is way faster. But if the appendix is already ruptured or things are complicated, doctors will do a traditional open surgery, which needs a larger incision. Now, I've used that word rupture a few times, and this is why appendicitis is always treated as an emergency. When you're dealing with an inflamed appendix, waiting is simply not an option. So what is the big deal? I mean, really, what actually happens if that inflamed little pouch is just left alone and it bursts? A ruptured appendix basically spills toxic, infectious material all over your abdominal cavity. This can cause peritonitis, a severe infection of your abdominal lining. It can form an abscess, which is a walled-off pocket of pus. And worst of all, that infection can leak into your bloodstream and trigger sepsis, a life-threatening, body-wide inflammatory reaction. This is exactly why time is of the essence. And that really brings us back to the main point. Appendicitis is a powerful reminder that our bodies have an incredible communication system. That pain that moves, the sudden loss of appetite, these things aren't random. They are specific, urgent signals. The only question left is, are you listening?